Hello and welcome to the information session for the Diagnostic Medical Sonography program. I'm Christy Flowers. I am the program director for the sonography program. So this information session is for you to gain information and knowledge on the program and the career and on the steps to apply to the program. So just a little about myself. I graduated in 2006 from the Medical College of Georgia. I have a Bachelor's of Science in Diagnostic Medical Sonography. I did get to learn echovascular plus general sonography and obstetrics and gynecology, and then got to choose which area I wanted to go into. So that's a little bit different from the associate's degree programs that we now have, where you kind of have to choose that pathway prior to getting into the program. I started at Trinity or Somerville Hospital, which is where we are currently located on the Health Sciences campus. I did general ultrasound call and worked as needed there. My first full-time job was at Augusta University's Medical Center. That is a large academic medical center. I did high-risk obstetrics and gynecology there before moving to Dr. Deborah Ware's office, which was a private practice where I did high-risk obstetrics up until coming here in 2017 to start the program. So what is a sonographer? We are a professional. We're part of a healthcare team. We possess the knowledge and skills, and we're able to utilize them for a diagnostic purpose. So in other words, we use our machine and our instrument, which is our probe, to create images which help a physician in making a diagnosis. We also provide basic nursing and medical care, and then CPR or emergency medical care would be warranted for us to provide for the patient if needed. Once you complete a program such as this and you take a registry exam, you are considered a registered diagnostic medical sonographer. Now that is recognized nationally. That is not something that you have to get state to state. It is a national certification. Excuse me. So again, we use specialized equipment to create an image of anatomy in the body with high frequency sound waves. So these images then help a physician in making a diagnosis. So we have technically 4 different specialties of ultrasound. There's general and there's OBGYN, which is essentially what diagnostic medical sonography covers, which is my program. There's also a vascular program and an echocardiography program. They both have exactly the same prerequisites as the diagnostic medical sonography program. So a lot of times students will apply to more than one of these programs. So these are housed down at Piedmont downtown, not at Piedmont Somerville where we are. The classes and everything are there, and then clinicals. But again, all the same prerequisites for both diagnostic medical sonography, vascular technology, and echocardiography. We just focus on different parts of the body. Please reach out if you want more information on vascular echo, and I can provide you with the program director's information for those programs. So more of what we do. We are members of a healthcare team. We are kind of a piece of a puzzle. So if a patient comes to us with a certain abnormal lab value or a certain symptom, we do an ultrasound to try to help tell us what's going on with the patient. We do get to work with all types of patients, infants all the way to elderly, and those that are healthy to those that are maybe critically ill in ICU on a ventilator, and then we get those that get to walk in and get on the bed themselves. So we get to the whole gamut. We get to use new and advancing technology. Now that is always changing. Our machines are always different. The ones you learn on in lab are going to be different than the ones that you use in clinic. We had to be able to adjust to that. Analyzing a patient's symptoms in lab work and then knowing how to adjust an exam. That is something that's very different for sonography. So if a patient comes in and they tell us they have pelvic pain and the doctor has ordered a scan of their right upper abdomen, we know that that's not going to give us the information that we need. So sometimes we have to adjust our exams to give the doctor the information that they need. We are also the eyes for the physician. So this is a big thing with sonography. Recognition of any pathology within the patient is our responsibility. So what that means is a doctor is not going to be standing over your shoulder watching you take all of these images. You're going to take the images and then you're going to send them or take them to the physician to look at them. And so if you didn't take a picture of pathology that may be there, it is missed, okay? So if you're looking at salary differences and wondering why sonographers get paid a little more than other imaging modalities, this would be why. A lot of imaging modalities take a picture of kind of everything, and then the doctor gets this overall view and gets to look and see if there's any abnormalities. We choose where we're going to stop and take an image. So we skip over that pathology or that abnormality, then it's not shown to the physician. So this is a huge responsibility and a difference from ultrasound from other imaging modalities. So once we do that scan, we then provide an oral or a written summary to the physician, helping receiving patients from the waiting room, scheduling patients, assisting with office and clerical work. If you work in a smaller office or clinic, you may have to assist with some of those things. Doing blood pressures, pulse, respirations, temperatures. We do all of that once you get into the program. But again, if you're in a smaller office, they may ask you to work patients up prior to starting their scan. And then providing that emergency medical care if the situation was to arise. So where do we typically work? Well, hospitals are going to employ the majority of sonographers. Those are going to be like large radiology departments or small radiology departments, depending on the size of the hospital. There's also physicians' offices that will employ sonographers, imaging centers that just specialize in different types of imaging, traveling ultrasound companies. These are generally temporary assignments, so they may be as short as 4 or 6 weeks, maybe as long as 6 or 8 months. So you get an assignment, could be all over the United States, anywhere in the United States, where you work as a sonographer. They pay you very well, and you get to just work temporarily and then move to the next assignment. Also, ultrasound equipment companies. So the companies that actually sell the ultrasound machines employ sonographers to do those sales, and they also employ sonographers to do the training on the machines once the machines are bought. So those are also options once you have some experience. Now again, schedules are going to vary depending on where you work, but again, a lot of sonographers work in hospitals. So our local hospitals are going to have a second and a third shift, which is a great improvement over what they used to do. A second and a third shift means there's somebody in the hospital at all times. So there's someone there for the day shift, there's someone there for an evening or a weekend or a night. And they rotate those schedules. Sometimes some hospitals do it where the same person's on nights all the time, the same person does the weekends. It really depends on the hospital. If they don't offer a second and a third shift, ultrasound services do have to be available 24 hours a day. So, for instance, let's say they don't want somebody to be in the hospital on Christmas, just to sit there if there's no patients. But if there was a patient that came through the ER or from the floor, then someone may have to come in to scan those. So there has to be ultrasound services available 24 hours a day. Private physicians' offices, which are like a lot of our OB offices, they're going to offer 8-hour days with generally no call. We do have some imaging centers and primary care centers in our areas. They usually do kind of some extended hours, and then I know one of ours does half a day on Saturday for patients that don't want to take off during the week for their appointments. So salary and job outlook. So according to a study done specifically in Georgia, the median average salary was $63,320, which was $29.96 per hour, and that is based on a 40-hour work week. So that is going to be average. Now, I wouldn't expect almost $30 an hour straight out of school, but $25 to $26 an hour out of school has been a good average for our graduates. And then a big increase of new sonographer jobs through 2030 of about 19,000. Now, I do have some videos in here, so hopefully you'll be able to hear them okay. And there's...
Sonographers are an elite group of medical professionals who use ultrasound technology to see the body's organs, tissues, blood vessels, and musculature. Sonographers are on the front line in the early detection and evaluation of high-risk pregnancies, women's health issues, cancers, heart defects, and arterial blockages. The sonographer uses their knowledge of anatomy, physiology, and physics to place a small device called a transducer against the skin in the area to be imaged. The transducer sends high-frequency sound waves into the body, which are bounced off internal structures in the body. After the sonographer makes the necessary adjustments on the ultrasound machine, a computer analyzes the reflected sound waves and creates an image of the structure. But unlike X-rays, no radiation is used. Sonographers can specialize and be certified in scanning different areas of the body. Abdominal sonography captures images of the abdominal cavity. OB/GYN sonography focuses on women's health issues, including pregnancy. Musculoskeletal sonography concentrates on muscles, ligaments, tendons, and joints. Cardiac sonography evaluates the heart and its blood flow. Vascular sonography evaluates the blood flow of peripheral and abdominal blood vessels. And breast sonography confirms the presence of cysts and tumors. Sonographers work closely with physicians and care providers to diagnose disease and are employed by hospitals, physicians' offices, walk-in clinics, and medical and diagnostic labs. It's an exciting and challenging career with tremendous opportunity. The Bureau of Labor Statistics predicts employment growth of about 26% between now and 2024, which is more than most professions. The median base hourly wage for sonographers is $34 per hour, which is over $70,000 per year based on a 40-hour work week. Sound interesting? The Society of Diagnostic Medical Sonography is an excellent resource to help you learn more about becoming a sonographer, getting certified, continuing your education in the industry, and getting the assistance you need to advance your career. Picture this rewarding career as yours. Visit sdms.org today.
All right, so just to note, those numbers that they quote for salary, they're going to be a little more national than they are in Georgia. If you choose to work somewhere like California, you are going to make a little more money than you do in Georgia. So that's why those numbers are a little more. All right, traits and characteristics that are important for sonography. Compassion is a big one. So a lot of times we see our patients at their worst. They maybe just don't feel good, or they're in pain, or they're scared and nervous, and sometimes they take it out on us, so they're not the nicest, but we've got to be able to be compassionate. I'm good at learning new technology and equipment. So like I mentioned before, there are certain machines that we will learn on in lab, and then we'll go to clinic and there'll be different machines. Pretty much everywhere has different machines. I don't know of any places locally that have the same machine. So you just have to be good at learning that new technology, adapting to it, understanding the basic buttons, and going forward. So excellent hand-eye coordination. We do scan with our right hand with general sonography and obstetrics, and then we manipulate the machine with our left. So a lot of times our students are right-handed, so it takes a little bit of time for them to adapt with their left hand using the machines, but we do have to be able to use both hands. Being detail-oriented, I mentioned before, recognition of any pathology or abnormalities on our scans is our responsibility. So being very detail-oriented with our scans is important. Concentrating in busy environments and handling stressful situations kind of go hand in hand. If you can imagine, say you walk into your radiology job and you have a schedule of one patient every 30 minutes, but then the floor has some patients that need to be done, and the ER has some patients that need to be done, and Miss Johnson is in the waiting room filling her bladder for her pelvic ultrasound, and she has really got to go, so she needs to be called back right now. So knowing that that's going to get done, but your day is not always just packaged and easy and handed to you. It can be a little stressful, and you've got to be able to maintain professionalism. Should enjoy learning. It is always changing. As I said, we get new machines, or we have new advances in technology. We also have to get continuing education credit hours. We have to have 30 every 3 years, which is not a lot, but that is, going to conferences, reading journals, and answering questions, things like that. And then strong in anatomy and physiology and physics. So anatomy and physiology is what we do day in and day out. So understanding a disease process and how that disease affects the organ that we're scanning, and then what it's going to look like on ultrasound. And then physics, which is very different from the conceptual physics that you guys are having to take prior to getting into the program. But ultrasound physics talks about the electrical pulse and how it comes from the wall, goes through the machine, and ultimately creates an image of the anatomy on the screen. So pretty neat. Technical requirements, so being able to communicate well with patients and others. I just want to note with this, we have students that come through that just don't like to talk to people, and that is okay. But if you know that about yourself, then go ahead and start working on it now. You've got to be able to talk to fellow sonographers. You've got to be able to talk to your fellow classmates, the physicians. Once you take the pictures, you've got to be able to talk to your patients. So if you know that you're a quiet person, if you know that you're an introvert, all of those things are fine. Just know that you've got to be able to break out of that shell and do what you need to do to get through school and in the profession. So performing tasks for 8 to 12 hours, you're going to be standing a lot of that time. So clinical hours are going to vary, either 8 or 12-hour days, along with shift once you get out. Being able to lift 50 pounds or more routinely goes along with assisting with moving patients. So you're not going to have to just, heave-ho and move a patient by yourself, but assisting moving a patient from a wheelchair to your ultrasound table, or from your ultrasound table to their hospital bed to go back, different transfers where you're helping the nurse or another sonographer move the patient. Being able to move and manipulate the sonographic equipment. So we do a lot of portable exams, and sometimes those machines are not as small as we would like them to be. Sometimes they are big machines that we have to push down the hall, manipulate, move into rooms. So being able to move and manipulate that. We work in very dim lighted rooms, so we work in dark rooms so that we don't get any reflections from lights or windows, sun, anything like that on our screen that would obscure something we could see with anatomy. Being able to prepare materials for procedures like sterile instruments and trays and patient care items, assisting the physician during invasive procedures like amnios or biopsies. So I want to stay on this one for just a second because I do have students that come to me and they say, well, I want to do sonography because I don't like needles and I don't like blood, and I feel like this is a good option for that. Well, I don't want to steer anyone wrong. There is no area of sonography that you can go into where you are not going to have to assist with procedures that involve needles and inserting needles into the skin and being able to either remove a piece of a mass or draw fluid out of the abdomen or different areas of the body, along with performing ultrasounds during surgery and at bedside. Generally, it's going to be once the patient is closed up, they want to make sure that all the blood is flowing correctly or that whatever procedure they just did looks like it's successful. I have had to assist with, I cannot even tell you how many invasive procedures and bedside during surgery or right after surgery ultrasounds. So I don't want anyone to think that this is a career where you won't see any blood or needles, because that is definitely false. So you need adequate vision, hearing, and touch. So we're able to recognize all of the variations in our images. They're very subtle changes of gray and also color that we impose on our image for different reasons. We need to be able to use both hands, wrists, and shoulders and maintain prolonged arm positions. For scanning, we need fine motor skills, being able to perform equipment maintenance and checks, and then providing physical and emotional support for our patients. I mentioned this before, but sometimes they don't come to us at their best, so we've got to be able to be there for them and get them through, help get them through. All right, so to get into the program, just some things. So observation, first of all, I've talked about some different areas of sonography. So if you're not sure which one is for you, then observation is going to be the best way to figure it out. Even if you're not sure if sonography is for you, just in general, observation is not a requirement to get into the program. It is just a suggestion if you're not sure about sonography as a career, or if you're not sure which area you like better. So it is a competitive admissions program. To be considered for admission, you have to complete all the prerequisite courses. Those are listed under the competitive admissions page for sonography. You have to have at least a 2.75 on those prerequisite courses. So any natural science course, that's anatomy and physiology and physics for our purposes. If it's older than 5 years, then it does have to be retaken. Any course that is retaken for a higher grade, then the highest grade is used. So for instance, if you took A&P1 and you got a C in it and you retake it and you get an A, then we will just use the A for ranking purposes. The ranking order is now based on English 1101, college algebra, statistics, A&P1 with lab, A&P2 with lab, and then your conceptual physics with lab. So we pull the grades out for just those courses, and those are what rank you for the program. You are required to attend the information session. So again, this will satisfy that. Once you answer the questions and email me back, then your name will be added to the list as attended. 10 are accepted into the program each fall. Now, medical terminology, it is not a required prerequisite, but if you haven't taken MedTerm prior to starting the program, then there is an additional text that you have to purchase and some additional tests that you have to take the first few weeks of the program. Perfectly fine if you want to do it that way, but if you have time during even the summer semester while you're waiting to find out if you get in, it is offered online, hybrid, and in person through Augusta Tech. So if you're interested in that, you can definitely reach out. So the admissions process, okay, you have to be a student at Augusta Tech to apply for the program. So even if you're taking classes at another college, that is perfectly fine. You're just going to have to apply to Augusta Tech, get your student 900 number, and get all your transcripts sent over so you can apply to the program. So you're going to take those prerequisite classes. Again, if you're taking courses at another college, then you have to get your official transcript sent to Augusta Tech, and that information is through student records once you apply to the college. In the spring semester, when you will be done with your prerequisites, you're going to submit the ranking application or the competitive admissions application. So that's basically the application that's on the competitive admissions page. You're going to print that out or fill it out electronically and email it to the email on that sheet. Ranking applications are available March 1st. They were this year. It may change slightly for the next years. Again, they're on the competitive health science programs page, which is from the Augusta Tech homepage. You can get to it. You must complete all the steps on that ranking application for the application to be complete. So don't just check a box and think, oh, I've done that. If you're not sure about it, definitely reach out, okay? Some considerations before applying. So this program does take a lot of commitment, time, and energy. It is not easy. It is not meant to be easy. And I say this every year to students coming in, it is not going to be easy. And they get in the middle of the program and they're looking at me like, what am I doing? It's not going to be easy. It's not meant to be easy. You are learning a career that is life and death in some situations. So it is not meant to be easy. It's going to be challenging, and that's what makes you the best that you can be. If you do progress to the sonography classes, they are full-time, so there's no option to do a part-time or an evening. They are full-time daytime. I would consider it a 40-hour week job with class, clinic, and a lot of studying. I have people ask me about working. Yes, you can work. We don't tell you you can't work, but just understand there will be clinic, there will be class, so you will be in class 4 to 5 days per week in clinic, depending on the semester that we're in. Clinical rotations are every semester. The sites are located in Augusta, Evans, Aiken, and Thompson. There may be additional sites that we add that meet our accreditation guidelines, but do plan to rotate through all sites. So, sometimes we have students say, well, oh, I live in Aiken, so I can just go to Aiken, right? No, because you can't get all of the competencies that you need only in Aiken. So you should plan to rotate through all of them. Generally, our clinical rotations are going to be 8 to 4, but occasionally, I won't say occasionally, pretty much everyone their first semester will have to do a 12-hour shift because of the limited number of clinical sites that we have, and we have 2 cohorts in the fall semester to place. Just understand that you need to be flexible with your schedule. Which days you go to clinic will change if you're doing 8-hour or 12-hour change. I did skip over the consent. So students are asked to sign a consent to be scanned during lab and class. So this means we have 5 rooms where we have ultrasound machines. We have 10 students. So one student is the patient for a certain amount of time, and then we swap, and whoever was scanning then becomes the patient, and the patient then scans. So the students get an opportunity to just practice on each other. We don't do any scans in lab that are sensitive, that I call them. So we don't do breast, we don't do scrotal, and we don't do transvaginal. In lab, we use our scanning dummies or our simulators for those. And so everything that we do in lab is not what I would call sensitive. So if anybody has any questions about that, if you choose not to sign the consent, then we would provide other ways for you to scan instead of scanning other students in the class. But again, if you have any reservations with that, please reach out because I could probably calm your nerves on that. So travel to and from clinical sites is definitely the responsibility of the student. Students must be able to perform all technical requirements discussed. Sonography is a pet profession where you listen to, receive, and then improve based on constructive criticism. So we have a lot of students, or I won't say a lot, but some in the past that have really had a problem with someone telling them they're not doing something correctly. That is how you learn with sonography. You are going to take a picture of that gallbladder and it is not going to be correct. There's going to be something incorrect about it, and myself or Miss Milburn or your clinical instructor are going to tell you, this is what I would have done differently. Let's try it again. Let's get it again. Next time, let's do X, Y, and Z. And that's how you improve, and that's how you get better with sonography. So also protocols and procedures are a big part of sonography. We've had students that just really despise the fact that every time they sit down to scan a liver, they have to get exactly the same pictures. So that is definitely how it is with sonography. We have a protocol for every organ that we scan. And again, for the liver, we sit down, we have our protocol, and we know exactly what images we need to document in longitudinal and in transverse for us to see everything we need to in the liver. And it's like that for every organ or a set of organs in the body. So a physics registry and a specialty registry have to be completed before you are considered a registered diagnostic medical sonographer. Do know that clinical situations can be high stress. Students have to maintain a high level of professionalism. Musculoskeletal work-related injuries are pretty common in sonographers. We do practice proper ergonomics to help you learn how to sit at the machine, how to hold your probe, how to hold your arm, how to sit neutral so you're not straining your back or your neck. These were not things that were even mentioned when I came through school, but we do mention it now, and you are graded on it so that we can try to stop any bad habits before they start and you injure yourself. The medical field is a service field. We are there to help patients, but we also put ourselves at risk in doing that. So there may be times that you are exposed to blood or other infectious material. We do practice standard precautions, meaning gloves, a gown, a mask, a face shield whenever that is needed, but we cannot take all of that risk away. I cannot take away a patient with the flu coughing on you or blood or anything like that getting on you during a procedure. That is a risk you're going to take. Sonographers are in high demand, and we have plenty of jobs open. Our students have had a great success rate with getting placed with jobs, but understand that they're competitive. You're going to compete with your classmates for jobs. Sonographers will be a part of a lot of sensitive exams. I've mentioned some of these, but transvaginals, scrotals, and breast are some of the most sensitive. I will say, I've had students say, well, I'm not going to do transvaginals, so I don't have to comp them, I don't have to scan those. No, you will. So every student that comes through the program has to do competencies, scanning in clinicals, scanning in lab on every type of exam. So again, we don't do transvaginals, scrotals, or breast in lab. We only use our scanning dummies or our simulators for those. But in clinic, you will scan transvaginals, scrotals and breast, and prove competency in scanning on all of those. So for legal considerations, you do have to complete a background check and a drug screen prior to being placed in the clinical sites. So once you get into the program, that information will be provided for you to complete that. So if there's anything in your past that you feel may stop you from being in the clinical sites or stop you from, the ARDMS also does a check, which is who administers our registry exams. So if there's anything that you feel like may stop that, you can contact ARDMS, you can contact myself. We have had some situations where we've run a background check early and sent it to the clinical sites to see if whatever is in the student's past may prevent them from placement. So that is a possibility also. So here's another video. Hopefully not an ad. Oh, it's an ad.
They live among us. Their morning routines are just like ours.
Doubler!
But when they go to work, something changes. It shows up on the mammogram, but I can't be sure if it's serious.
Got it.
It's benign.
Hi, Mrs. Perez. How are you today? Running around like crazy. Right after this, I have to return one of the 2 car seats I got at my baby shower. And then I have to pick up my son from daycare. He's so excited about being a big brother.
Mrs. Perez,
Yes?
you're gonna want to hang on to that extra car seat. All day long, their amazing skills, knowledge, and insight give doctors and patients the images they need. They are sonographers. Thank you for being a doctor.
All right, so just a fun one. We don't always feel like superheroes, but it's what we do is very important. So some general program information. So it is an Associates of Applied Science. It is 4 semesters once you start the sonography courses. So after the prerequisites are done and you're accepted to the program, it is then 4 semesters. So the Diagnostic Medical Sonography program, the program I am over, covers general sonography, obstetrics and gynecology, small parts, pediatrics, invasive procedures, and then we do an introduction to vascular sonography. So remember I mentioned there's a full vascular program. We do not cover as much as they do, but we do an introduction into it, into scans that they want students to know or graduates to know once they start working in a radiology department. So just some of the scans that you'll see, obstetrics and gynecology. So a lot of people are familiar with ultrasound for OB, these precious baby pictures that people bring home. Of course, there is so much more to OB scanning than cute pictures. Looking at everything on the baby from head to toe and understanding the anatomy and looking at everything normal, make sure there's nothing abnormal, and also looking at the maternal anatomy. So up here, I mentioned transvaginal scans. So this is actually a transvaginal scan of a uterus. So we would do these on women who have pain for different reasons, or they're having bleeding issues. I do want you to understand, again, a probe is inserted into the vagina of the woman for us to get up close look at the uterus and at the ovaries, for us to find out why the lady is having pain or bleeding issues, okay? So down here, an introduction to vascular. So we do carotid arteries in the neck, and we do venous Dopplers in the legs. So those are the two main vascular studies that we do within our program. Okay, so again, vascular program covers a lot more than that. Over here is for abdomen. So these are all small parts, or no, I'm sorry, not small parts, soft tissue organs that we can scan routinely. So up here is a gallbladder with a gallstone. This is a kidney here with blood flow. This is a liver. Right here is a pancreas and all the vascularity around it. And then this is a spleen. So all of these organs we can routinely image within the abdomen. You would learn that. Over here is neurosonology or pediatrics. So one part of pediatrics is looking at the neonatal or baby brain. So a lot of premature infants have a high risk of developing a bleed within the brain. So we will scan to see if a bleed has occurred, and if it has, we'll do follow-up studies to see if medications they're giving are stopping it. So this is just some of those images. There's also some different areas of pediatrics that we teach that you will also learn and scan. So over here is small parts. So this is a thyroid gland in the neck. This is a cyst in the breast. And then this is a scrotal scan here. So all things that we would scan also. These are some of the invasive procedures that we do. So up here is an amniocentesis, which is taking fluid from around the baby. So here in this image, we have baby here. Here is placenta, which is the go-between between mom and baby. Up here is where our probe is touching the patient, and this is the needle. So what we're doing is guiding the physician to where that black area is, which is where the fluid is. We want to show the doctor a good area where there's not baby, not placenta, not umbilical cord, so that they can get a sample of this fluid. So down here is fluid also that we're trying to give for a different reason. So this patient had some type of disease process that made them produce too much fluid in their abdomen. Certain cancers can do this, liver failure can do this, other reasons also. But you can see the difference in this patient here after they remove the fluid. So this is bowel within the patient. This is again where our transducer is touching, and this bright white is the needle that is coming in. So again, we're showing the doctor where this fluid is at so they can remove it this time to make the patient more comfortable. Over here is a breast biopsy. So if you don't have a family member or yourself hasn't had a breast biopsy, these are done a lot. So people will have an abnormal mammogram, they'll come back for a diagnostic mammogram, they'll do an ultrasound, and then many times they will biopsy the area just to confirm if it is or isn't malignant. So again, this is what we see on our screen. Here's the mass here. So we're trying to get a core sample. So again, the needle is put in, and then a sample of this mass is taken so that we can see if it is malignant or not. We do have small class sizes. I mentioned that we accept 10 students, so it allows for a lot of personal attention and guidance. There's 2 instructors. We are committed to your success. We've had situations where we've had to, go to local hospitals or imaging centers and have imaging done, ultrasounds done, and we've had our students do it, and it's great to know that we feel confident that our students are doing it, our graduates are doing it, and that they know what they're doing. So we do have our scanning lab has 5 ultrasound machines, 5 imaging tables, 5 ergonomic chairs. Our machines do have 3D, 4D capabilities. Transabdominal and a transvaginal simulator by Metaphor. So these are what we practice, those sensitive type of exams, and we also practice with pathology, because many of the times when we scan each other, our anatomy is normal. So we can actually assign different pathologies. Let's say we're talking about gallstones in the gallbladder today, so we can assign you scans on the simulator that are gallstones for you to actually scan, since most of us won't have gallstones in lab. We also have ultrasound phantoms. So these are like what I call the scanning dummies. So we have a transvaginal, we have a neonatal head, a second trimester OB, a thyroid, a breast, and a scrotal. So again, those sensitive exams that we don't get to practice on each other, but also we don't have babies, right? Just readily available for us to scan. So we have the neonatal head for that. And then we don't have a lot of pregnant students. So we have a second trimester OB to scan that. So students are going to take courses in abdominal, pelvic, vascular, obstetrics, pediatrics, and small parts, scanning and anatomy. So those classes are going to have scan lab time built in. There's actually more time in lab built in than there is lecture time. Sonography, physics, sectional anatomy, and specialized procedures are also taught in the course. We have 2 registry review classes that prepare the students for their physics registry in the second semester and their specialty registry in either abdomen or OB in their last semester. So we have 4 clinical classes that are taken throughout the program to help improve confidence and scanning skills. We have a wide variety of clinical sites. So we have larger hospitals, smaller hospitals, imaging centers, physicians' offices, so you get well versed and know kind of where you fit in better. Expenses and responsibilities. So total for books is $782 for the program. Now that was for this past year, but that may vary in future years. Usually not significantly, but a lot of times with inflation it does go up. I recommend 4 sets of uniform scrubs. Those don't have to all be bought at the same time, but you will need a lab coat, shoes, and at least 2 sets at the beginning of the program. You are in clinic up to 4 days a week during the summer. And so if you want to just get 2 and wash them, that is perfectly fine. We'd recommend 4 just so you have enough for the week. You will need general school supplies. You will need a jump drive or thumb drive for you to get the images that you take on the ultrasound machine in lab off of them and to turn in to us. Liability coverage is $6 per semester, and it is added to your tuition if you are in a health program. Your criminal background check and drug screen is about $100, and that's once you get into the program. If for any reason the drug screen is not accepted, sometimes they come back as inconclusive or diluted. If there's a retest that's warranted, that is also the student's responsibility. So immunizations and physical exam. So just to pause here, all immunizations, you have to have proof of that. Most of it now, you go and get a blood draw that proves whether or not you have active immunity to certain things, and then you may need booster shots. I do also want to mention here that as of now, our clinical sites are requiring that COVID vaccination. They are requiring, our students coming in are required to have the COVID vaccine. That is due to the fact that our clinical sites require it. It is not an Augusta Tech requirement, but our clinical sites are how you get your clinical experience. You have to do that part of the program, and our clinical sites are requiring it. If you would like more information about that, if you would like to speak to my dean, anything like that, please reach out. You do have to have health insurance. So even if it's just a catastrophic type plan, like if something was to happen, an emergency type situation, you just have to have something with health insurance. Again, that is a clinical site requirement, not an Augusta Tech requirement. TB skin test, so this will be part of your physical exam. That has to be done. The SPI exam, which is the physics exam, that is in the second semester, and it is $250. The specialty exam is in the 4th semester, and it is $250. Specialty exam would be either abdomen or OB, or you could choose to take both, which again, means you pay $250 twice, but you are eligible to take both. CPR, once you get into the program, we will provide you with the name of some places. It's usually about $60 to get that certification. The electronic clinical record, once you start clinic, the 6th week of your first semester, you do have to set up your electronic clinical record. This also, though, creates a clinical portfolio. So it'll have how many livers you've scanned, how many pelvises you've scanned, how many babies you've scanned, and what trimester, so that you can present that when you go to get a job. Clinical travel, we talked about that to and from sites. There may be other costs. I do have an Excel sheet with all of the prices on it. If you would like a copy of that, you can email me and I will provide it. So this is how we figure out our tuition. This was 2023. So our semesters are either 12, 13, or 14 hours, and this is total tuition for each of those semesters. Last video, and then we are done. This one's my favorite. So here's just some contact information. Of course, my information there at the top. Alda Milburn is our clinical coordinator and the other instructor for the program. And then Artavia Littlejohn, she is over the Academic Advising Center. She helps with the ranking. So you can also reach out to her with questions. So if you are watching this to satisfy the requirement for the information session, make sure that you email me back with the questions and answer the questions that I've got for you. If you just are watching this for information, no need to email me back, but feel free to email me with any questions or to contact me with anything else you may need. Thank you. I've enjoyed it. Have a good day.